listening to PetLifeRadio.com.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Visit us at battle-cancer.com for more information on how Ellie Mae supplements can help your dog.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
If you were to walk into any major pet supply store in the United States, you'd be inclined to think that diet alone could prevent your pet from developing dental disease. I'm sorry to say this is so far from the truth. It's estimated that at least 75% of pets over 4 years of age have some form of dental disease. Which develops significant problems is a matter of genetics, routine veterinary dental care, and consistent home dental hygiene. Yes, you can brush your pet's teeth. I'll be speaking today with Dr. Heidi Lobprise, a veterinarian, board-certified veterinary dentist with Pfizer Animal Health. We'll be talking about Thanksgiving and some problems that our pets get into. We'll be right back after this short message.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Did you know cancer is the #1 cause of death in dogs? 1 out of every 3 dogs is affected by cancer at some point during his lifetime, and half of those dogs affected die. Shocking, isn't it? Symptoms of dog cancer are nonspecific and often lead to a late diagnosis of the disease. But before it reaches an advanced or incurable stage, cancer exhibits mild but recurring symptoms. If you think your dog is losing weight, has a loss of appetite, looking dull and listless, is non-social, or has any sores, swellings, bumps, or lumps, or abnormal growth anywhere, it's time to visit the vet to make sure everything's well. This message is brought to you by Ellie Mae Pet Supplements. Ellie Mae is an animal healthcare company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.
Is the coast clear?
Yes! Let's go!
Are you sure they went to Petco?
Where else would they go?
Oopsie!
Calm down!
I smell presents!
Go to PetLifeRadio.com/Petco and get $6 off your order of $60 or more, and up to 40% off hundreds of holiday items at Petco. PetLifeRadio.com/Petco.
Uh-oh, step on it!
Okay!
Oh, not on my tail!
Petco, where the pets go.
Hi, this is Ken Jones from the Prince of Ponds podcast. The frogs are shaking the shakers, the turtles are hitting the slapsticks, and the koi are blowing the trumpets. It's party time here at Prince of Ponds. Out under the swaying palm trees, the pond fairies are kicking up their heels and spinning in delight in the twilight. Here on Pet Life Radio, it's time to celebrate the magic of ponds, waterfalls, fountains, and water gardens at the Prince of Ponds podcast.
Let's Talk Pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Lobprise, thank you so much for being with us today. How common, I was saying it's about 75% that of animals would be affected with dental disease. Would you agree with those numbers?
Oh, I think that's definitely a strong number to go with. Just think if people never brushed their teeth.
Now, when do you need to start? Do you start when an animal is 4 or 5 years of age brushing their teeth?
I like to think from cradle to geriatrics, even though it may be a difficult discussion on the very first puppy visit to your veterinarian because you're talking about food and vaccines and basically potty training. I think certainly a good oral exam at every visit. Your veterinarian can show you how important these teeth are, and getting the puppy used to, at a young age, having the head handled, having the mouth handled, and even some very gentle brushing at a very young age can set the stage for a lifetime of good dental care.
Now, you mentioned dogs. How about those kitties out there?
Cats can be a bit more challenging at times, but it's
That's
not
an
impossible.
understatement.
It's not impossible. If we can't do a good, thorough brushing, there still are some good gels and solutions that we can use with kitty cats.
Does food really help?
Dental diets and dental treats can be helpful. The biggest help they give me is when owners come in talking about the dental diets. That opens up the door for me to help further their education. That's a good step, but dental care is a complete program. Good exams and regular home care and regular professional care throughout the life of the pet.
Regular home care. I know we're doing radio, but imagine that you can tell us, how can we do this at home? You have that new puppy, new kitten, or even if it's not a new puppy or kitten, it's an older animal. How can you get them used to getting their teeth brushed? What are some steps that you can do?
Like with every training, you start out slowly. You give rewards. It may be playing with a ball afterwards versus a treat. But as you get your animal more used to having the face handled, I talk about gently grasping the muzzle with my less dominant hand. I'm right-handed, so I use my left hand. That way I can gently keep the head under control so they don't accidentally open up the teeth and close them down on me. And initially starting with a gauze pad, or even just your finger, rubbing the side of the face, gently lifting up the lips, and even gently touching the teeth and gums. From there, you progress to a soft toothbrush, and I definitely recommend veterinary toothpaste, not human toothpaste. Dogs and cats don't know how to spit them out. And you can gradually build up this routine to where it's accepted.
And the next question is, how often?
Daily brushing is always best, by far. Now, I realize lifestyles can sometimes make that somewhat challenging. So I always recommend daily brushing, so sometimes we get it 2 to 3 times a week. If you can't do good, effective brushing, then you need to be more careful about getting the other parts of that dental program, making sure your animal gets its mouth examined at every exam when it goes into the veterinarian, and when there's a recommendation for professional cleaning. Make sure you get that scheduled, because that can be a very important part of this dental program, and a lot of hidden problems can be found while the animal's there at the veterinarian's office.
Now, some people say that, okay, my groomer has a non-anesthetic dentistry. They have somebody coming in to clean the teeth. What's your view on non-anesthetic dentistries?
As we're looking at dental disease, periodontal disease, what we see is going to be the calculus or the tartar on the tooth surface. What we don't see is the disease that's really occurring beyond the gum line, up underneath that gum surface. And believe me, I don't care how good the patient is and how thorough the person can be, there's no way you can do a good subgingival cleaning where the disease really is worse.
So it's really just a matter of cosmetics. It may look good on the surface, but there's still really lots of problems. Can you define for people what is periodontal disease again? Because oftentimes we throw out terms, but it's like, what's that?
Sure, and I think commercials today have helped us educate people. They know the term gingivitis. That's the gum tissue when it's red and puffy, maybe just a little bit of a minimal infection going on. But when we see periodontitis, periodontal disease, that's when we have bacteria in the plaque, that soft film on your teeth, or in the calculus, the tartar on the teeth, and this bacteria actually infects the tissues around the teeth, the gums, the bone, the ligament that holds the tooth to the bone. And with this infection, if we don't get good treatment and even prevention, we can end up losing bone, we can end up losing gums, we can end up losing teeth. But you know what? This infection doesn't just stay around the teeth. The infection can get into the bloodstream, and there's been studies to show the association of this dental periodontal infection with infection and disease in the organs and the rest of the body. So it's not just about dirty teeth.
Looking at a dog with bad teeth or a cat sometimes, and I tell a client, your pet needs to have its teeth cleaned. And many times they'll have this dumbfounded look going, I've owned dogs and cats for years. I have never had their teeth cleaned before. If, this animal comes from a wolf, and those wolves in the wild, they never get their teeth cleaned. Why do I need to do it?
Yeah, and there's your door open for education right there. As we look at our patients, number one, there's a lot of head shapes out there that aren't exactly like a wolf. We're getting a lot of smaller breeds with crowded teeth. We have a lot of our flat-faced breeds, what we call our brachycephalic dogs, that really have some interesting teeth problems. We don't have good chewing on proper substances that might really clean the teeth, let's say skins and whatnot, that might help clean the teeth better. And as we're looking overall at the ages of our patients, we're providing such good care. We're getting an aging population in our pet population. And it's really important to make sure that we have good dental care as part of that overall care so we can help keep the quality of life good and maybe even help the quantity of life with our family members.
Dr. Lobprise, you mentioned right now chewing, and many times people want to give things to chew on to help the teeth. Are there some good suggestions of what they can chew on and some things that they should avoid? Even talking about maybe a little cat info too, if you could?
Sure. Each patient is different, but there are some rules that we kind of need to look at. One rule of thumb I use, if you can take the object and when you hit it against the wall, if it puts a hole in dry board, it's probably too hard for the dog's teeth.
Okay.
I do know one veterinary dentist who actually hits it on the owner's shin.
Okay.
And if it hurts, it's probably too hard. Think about how a dog
I don't think I want to go to that
chews.
dentist.
No, but I think he tells it as a joke. Think about how a dog chews. They really get that chew toy back behind those back teeth and grinds down. They've got a lot more muscular force than we do with our teeth. So if it has any kind of diameter and has no give to it, there's a chance they can break their teeth. So we have to watch for that. Bones, cow hooves, things like this can break dogs' teeth. Ice cubes aren't good for dogs or people, by the way.
But it's fun to chew on.
Well, when I look at recommendations, I like something a little bit flatter, something that has some give to it. If they really like rawhides or something along those lines, even soaking them so they have a little bit more compressibility. There's some good specific dental chew items out there, flatter rawhides with dentifrice with toothpaste in them, things along those lines. We can look at appropriate chew toys. And if you have a dog that's going to go out there and chew, and believe me, it happens, rocks, logs, houses, furniture, etc., then you have to watch the teeth. Make sure they don't break the teeth and keep a good monitor on them.
I know it's very frustrating sometimes when a client says, well, the teeth look good, and they'll lift up the front lips and they'll lift up the lips, and you'll see the incisors, those little teeth in front, and the canine teeth, and many times they look good, but they don't always take a look at all of the teeth. You had also mentioned our aging population because now veterinary medicine is able to extend that good quality of life for pets, that our pets are getting older. Oftentimes people don't think, gee, what happens to the human population? I myself, now that I'm getting more mature, I'm now having to go to my own dentist 4 times a year to have my teeth cleaned. And as I'm explaining to people when they say, well, I just had their pet's teeth cleaned 2 years ago, why do I need to have it again? I said, well, I brush, I floss, I use an electronic toothbrush, and I go to my dentist 4 times a year because now that I've gotten older, I am building up more tartar despite everything that I'm trying to do. So is the same thing true for pets?
Absolutely. And when you look at the relative length of the lifespan, 2 years in a pet's life is a long time compared to ours. And if we went that period of time without good dental care, it would really impact our health. Often, we also get ready to do a dental procedure on a patient, and as we get in there, we get big surprises. We take off a little bit of the calculus, or we look at the back teeth, and all of a sudden, now we have deep periodontal pockets. We've got deeper infection than we ever would have imagined. In fact, I make sure that I can contact my pet owners during the procedure because usually in dentistry, I'm going to have a surprise or two. It's easy for those problems to remain hidden. until we get them under general anesthesia and take dental radiographs to see what's going on, probe the teeth, look for pockets, look for those issues, and then make our best effort to correct them.
What are some of the techniques that are now available in veterinary dentistry? What kind of amazing things can you do to save teeth?
Okay, and hopefully people won't laugh too hard at these things. But needless to say, I love teeth. You know me, I love teeth.
You're the original veterinary dental fairy, yes.
Oh, absolutely. Dental goddess.
Oh, dental goddess, excuse me.
Oh, yeah. I got promoted last year.
Okay.
Certainly, I think in a lot of standard practices, good periodontal therapy, where we can do what we call root planing, cleaning up underneath that gum line, using antibiotics up underneath the gum line to help heal the areas, even doing special surgical periodontal procedures where we implant materials that can build back bone that's already been lost. In people, they do this on a regular basis. In people, they do implants a lot to help exercise the bone and keep things healthy. It's not as useful in patients, but I have done root canals on patients when they break their teeth or they have a discolored tooth. We've done crowns, and those can be quite impressive, especially on a large dog with a large canine tooth. And believe it or not, we've even done orthodontics on some patients that had painful malocclusions.
So translated, you're talking about braces.
Pretty much, yeah. Some brackets, some braces, some what we call inclined planes. We believe every patient should have a comfortable bite. They don't need to have a perfectly pretty bite, but they don't need to be in pain.
Well, that sounds as though a lot of people probably are giggling right now, but if they realized how important the teeth are to the overall health and welfare of their pet, hopefully they'd stop giggling and realize that let's lift up that pet slip and see what's going on. Dr. Lobprise, we're going to be taking a short break right now to hear from our sponsors. So please stay tuned and we'll hear what other wonderful things are going on underneath the lips of your pets and how veterinarians are helping take care of them. Stay tuned.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
The Boo Boo Loon Pet Recovery Collar is an innovative inflatable product that comfortably restricts pets from harming most surgical wounds, skin disorders, and obsessive licking or scratching. It's the humane alternative to the hard plastic cone and other devices. The Boo Boo Loon is easy to use and designed to be soft, fully adjustable, and pillow-like, allowing for unrestricted vision and complete freedom of movement. Sizes range from extra small to extra large. So join the Boo Boo Lution, become a Boo Boo Buddy on Facebook, or check out boobooloon.com. BOOBOOLOON.com.
It's the holidays at PetSmart, so come one and all. There are hundreds of gifts for pets big and pets small. Toys only at PetSmart, so special and new. They'll love the gifts. You'll love the value. Hurry to PetSmart today for your very best friend and save 30 to 50% before the holiday ends.
The holidays are just around the corner. Go to PetLifeRadio.com/PetSmart and save up to 30% on awesome gifts for the pets and pet people in your life. Toys, collars, leashes, PetSmart gift cards, treats, and more. So shop early and save money. Go to PetLifeRadio.com/PetSmart today.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Ellie Mae is an animal health care company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.
Hi guys, this is Skylar Samuel.
Hi, this is Rochelle Pfaff from the Twilight franchise.
Hey, what's going on? It's Tyler James Williams from Everybody Hates Chris.
Hey guys, it's Caroline Sunshine from the new movie Marmaduke.
You are listening to the amazing, unstoppable Kristen Powers.
Pets Rock.
Pets Rock.
Pets Rock. Pets Rock.
Pets Rock on Pet Life Radio.
Hey everyone, this is Kristen Powers of Pets Rock at Pet Life Radio. We'll see you next time.
Every week on demand, only on PetLifeRadio.com. Pets Rock. Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
We've been talking today with Dr. Heidi Lobprise from Pfizer Animal Health. She is a board-certified veterinary dentist. We've been talking about root canals, brushing teeth, why it's so important for your pet's overall health. Dr. Lobprise, you've been talking a lot about dogs. Kitties. We see a lot of cats in my own practice. Oftentimes people think, a little tuna breath between friends, there's nothing too bad there. What are some of the unique problems that cats run into?
Cats are unique. In fact, I claim they're from a different planet. It explains a lot about them. Cats do get periodontal disease. They can get that infection from the bacteria in the plaque, and they can have gum loss and bone loss like a dog, but typically at different rates. In other words, sometimes we'll see a cat with a lot of calculus and very little disease, but sometimes we'll see some cats with just a little bit of calculus and plaque and really bad inflammatory disease, very red gums, ulcerated gums, painful, even gums that overgrow so much they can barely eat and barely breathe. This is a condition called stomatitis in cats. It's a very broad term. It just means inflammation in the mouth. Stoma is an opening or mouth. The thing of it is, with these cats with a severe inflammation, it can really affect their quality of life. They're painful, they don't groom themselves well, they can't eat well, and they can seriously be affected. It's one of those conditions that's important. If you think your cat has any oral discomfort or problems at all, make sure you have your veterinarian check them out thoroughly.
Are certain breeds more prone?
We do see certain breeds, some of the exotic type breeds. I myself bought an Abyssinian, and he was toothless by the time he was 7. So there are some breeds that are prone, but we see it in almost any breed. And the thing of it is, this can come on gradually to where you might not notice it that much, but it's tough to get a handle on. This is more than just standard periodontal disease. This is almost an animal whose immune system is overreacting, like a severe allergy. Sometimes
so they're allergic to their own teeth?
Sometimes to the plaque on the teeth, sometimes to different bacteria. Sometimes they have viruses that can make it worse. We don't have all the answers yet.
What type of treatments are available for these cats?
Good general care, professional care on a regular basis. A lot of people think about going and getting the teeth cleaned every year for your patients. Well, these ulcerative, painful cats need to go in probably every 3 to 6 months. Sometimes antibiotics will help occasionally, but we're very cautious about how we use antibiotics. Sometimes corticosteroids, like prednisone, may help decrease inflammation, but again, we have to be careful about the side effects. And sometimes these patients get so uncomfortable that we end up extracting some of the teeth in the back of the mouth to make them more comfortable.
There have been some cats that I myself have seen. Abyssinians seem to be overrepresented in this group, where I've had to counsel clients that we've tried all these various things, it's just not helping. Really, I think it's going to be best to extract the cat's teeth, and they are just aghast. How can this cat eat if the teeth are extracted? Have you seen that there's a problem with these kitties afterwards, after their teeth have been extracted?
I tell you what, with some of these painful kitties, and even any extractions in the pets, but especially these cats that have been so painful, they almost seem so relieved to have the discomfort taken care of, to have the pain brought down. I have seen them try to eat that day when they hadn't been eating well in a long time. And remember my toothless cat? Mm-hmm. His name was Chewy. Not for teeth, it means leopard in Swahili, but believe me, he could eat quite well without a single tooth in his head.
And I think if most of us, I myself own 2 cats, and most kitties I really do think swallow and never chew their dry food. It's, small enough they chew, but 99% of it seems to go down whole.
I think inhaling is a good word. I had a cat that I really thought did almost inhale food. Sometimes he ate so fast. Chewing is not a big part of most cats' eating plan, but certainly we need to make sure that we keep the teeth healthy, because when they're not healthy, the cat's not healthy.
Another problem that I see frequently in cats, basically I think a client would think of it as a cavity, the fancy term being resorptive lesions, these breaks in the enamel right at the gum line. Talk to us a little bit about resorptive lesions in kitties. What causes it? What can be done?
Whenever I see a cat for an oral exam, the very first tooth I try to look at is a premolar on the lower jaw, what we call the lower third premolar. That is the most common tooth to show the first outward sign of this tooth resorption. When I look at that tooth, if I see that there's a defect, that there's looks like a cavity in that tooth with gum tissue growing in it, I immediately tell the owner, guess what? We have a painful lesion. Do you remember the vet I told you about knocking the shin with a chew toy?
Yes.
I believe it's the same veterinarian who talks about taking a cotton swab and touching one of these teeth in front of the owner. I don't recommend that because when you touch these lesions, the jaw chatters. They're so painful.
I've even seen when a cat's under anesthesia, their mouth will chatter when you touch that spot.
Under general anesthesia, you could be fixing a broken bone and they're fine. You touch one of those teeth and the jaw does. It's just so painful. What's going on with these teeth is that cells in the jaw, bone cells, start churning the root into bone. So the whole problem starts a lot earlier before we ever see the problem on the tooth surface itself. So that means I really need to get that patient in. I need to get good intraoral radiographs, x-rays of the teeth and the roots. And if we do have a lesion that's extended to the crown or the outside surface of the tooth, I know it's painful. Typically, I need to talk with the owner about extracting what I can of that tooth because these resorptive lesions tend to be progressive, and we sometimes see other teeth affected that we hadn't expected. So we need to check out all the teeth.
You mentioned that some of the problem may be an immune reaction where the body starts to react to some of the bacteria in the mouth. I know that Pfizer Animal Health has come out with a vaccine for periodontal disease. Just for dogs at this point in time, can you tell us what it's meant to do, how it helps?
Correct. There is now, and you'll have to bear with me here, since it's a conditional license by the USDA, the actual name is Porphyromonas denicanus gule salivosibacterin.
That one is really good.
Yeah, it's a vaccine against the 3 bacteria that was in the name, Porphyromonas bacteria. When we see plaque on the tooth surface, there's a lot of bacteria. Some of them are good bacteria. But if we don't brush that plaque off, if we get a lot of calculus, if we get a lot of disease, then we end up getting these bad bugs, the Porphyromonas bacteria. Anytime you look at a disease, it's always better to prevent it than to treat it afterwards because the animal has to go through the process of the disease and it's painful and there's an infection. So we like to prevent things when we can. Animals vaccinated, dogs vaccinated with the Porphyromonas vaccine, we use it as an aid in the prevention of periodontitis to help keep these bacteria at bay, to help decrease their effect, so we'll have less disease with the periodontitis, with the destruction of bone and tissues. Now, as a conditional license, there has been safety studies done showing safety as young in dogs as young as 7 weeks of age with what we call a reasonable expectation of efficacy. So as we're looking at that complete dental program we talked about earlier, good home care, regular dental exams at your veterinarians, good professional dental cleanings and treatment, your veterinarian can look at the patient and decide if they're a good patient for the option of using the vaccine.
So any downsides from this? Sounds like it's a great vaccine, a great aid.
As we look at vaccines, I still look at each patient and see what's appropriate. If I have a patient that is a high vaccine reactor or has a family history of immune problems, I may not give a vaccine to that patient in particular. While it does say safety in as young as 7 weeks of age, there's a lot going on in 7-week-old puppies with other vaccines and whatnot. I like to make sure my breeds at risk, especially the small breeds, the brachycephalic breeds, that they get vaccinated before a year of age. And I do know I've seen some patients that after having their vaccination feel a little sore and stiff the next day. I compare it to when my daughter used to get her vaccination at her doctor. And so we'd break out the anti-inflammatory, we'd break out the ibuprofen for her, but certainly we don't use that in our dogs.
Well, it sounds as though dental care has definitely advanced dramatically, at least from the time that I know I was in veterinary school. Are finding dog and cat dentists difficult now in the United States, or are there more and more of them?
There are getting to be more and more of us. There is certainly a group of board-certified veterinary dentists. The American Veterinary Dental College is the group that we belong to. There's also a lot of veterinarians who get additional education on their own to make sure that they can provide good basic dental care in their own practices for their patients. Certainly a couple things to look for. Are they taking radiographs? Are they doing the complete workup prior to the general anesthesia? Good monitoring, IV catheter and fluids, take those radiographs, give options for treatment. If there is a broken tooth and there's a veterinary specialist around, maybe a referral for a root canal instead of extraction. So the field has definitely grown, especially since I've been in school, too.
Since you're talking about going under anesthesia, I know many times since we're taking care of our pets in such a way that they're living longer, you'll get the client with the older pet, the cat or dog who is 15 years of age, and it desperately needs its teeth cleaned, going, I'm not going to put this pet under anesthesia because it's old. How do you address those concerns?
Well, I think when I was able to visit you one time, the O word is not my favorite one, but, mature. I liked how you used that earlier. Age is not a disease. Thank heavens for that, for both of us, huh? As you're looking
I take
at these
that
patients,
personally, Dr. Heidi. Thank you very much.
Well, you and I get along well, so that's
Yes.
good. Doing that good workup ahead of time. Blood work. IV catheter and fluids. Good monitors. Monitoring the blood pressure can be very important. Letting that patient continue with that infection that can affect the rest of the body can be more dangerous than putting it off. Now, you make sure that you're as stable as you can get them. We have some excellent anesthetic protocols these days and excellent anesthetic agents, ways of monitoring to where if we do have any concerns, we can either bring them up out of anesthesia or make them lighter. So there's some very good, safe ways to do it. There's always risks. There's always going to be a risk, even with a young, healthy patient. But the ongoing risks of the periodontal infection and what it can do to that patient, quite often the benefits of getting it done is far outweighing the risk.
I'll usually also tell clients the pet's not getting any younger and the teeth aren't getting any better. So let's do this workup.
Have you had some of those patients where you finally talking them into getting it done? They come in, antibiotics, pain medications, they get some of the extractions, get the rest of the teeth cleaned. What do the owners tell you 2 weeks later?
Why didn't I do this before? Why didn't I listen to you? The pet is feeling so much better. It's eating better. The breath smells great. It's no longer buzzard breath. It's seeming to have more enjoyment in life, running around happier. Yes, more people than not say, this is the best thing that I've done. I wish I had listened to you sooner.
Yeah, and sometimes I tell people, if you had an infected mouth, if you had a sore tooth, you'd be miserable. It's not about the dirty teeth. It's about the comfort and the health of the patient.
Dr. Heidi, you've given us some fantastic information. If people wanted to learn more about the vaccine, more about dental care, where can they go?
First and foremost, your veterinarian. I will always recommend that. And certainly, we have information from Pfizer specifically. And for those who might be listening who are with veterinary practices, the American Veterinary Dental Society is a great resource. You don't have to be a veterinarian to join. You can be a technician or animal health care giver. And that's www.avds_online.org. It's a great group.
Fantastic. You have given us some marvelous information. Hopefully everyone now, after they've listened to this podcast, will go ahead, lift up their pet's lips, take a look at those teeth, make an appointment if necessary to see your veterinarian to have it addressed, because it really is important. Dental disease is so much more than just a cosmetic issue. An unhealthy mouth allows bacteria access to the body's blood supply. The shower of bacteria can cause irreversible damage to the liver, kidneys, and joint, and the heart muscle. The damage may not be immediate, but insidious in nature. So wondering if your pet could benefit from some dental care? Just ask your veterinarian. And why? Why does this matter? Because it's your pet. Health matters. So stay tuned. I'll have a little bit of some information for you right after this break. We'll be talking about Thanksgiving and some problems that our pets get into. Dr. Heidi, thank you again so much.
Thanks for having me.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Dyson.
The new Dyson Animal Vacs are powerful bagless upright vacuums for homes with pets. Air muscle and radio root cyclone technology generates the strongest suction power to powerfully remove dust, dirt, and pet hair from the home or car. To order your Dyson Animal Vac, go to PetLifeRadio.com/Dyson. PetLifeRadio.com/Dyson to order your Dyson Animal Vac today.
Dyson. Music to your ears.
Love your pets but wish their medications were a lot less expensive? They are at 1-800-PET-MEDS. You'll not only save on flea and heartworm medications, but on prescriptions for arthritis, incontinence, thyroid, and more. And you get fast service, free shipping, and a 100% satisfaction guarantee. Plus, our licensed pharmacists ensure accuracy, monitor drug interaction, and more. See why over 5 million people have trusted their pet's health to 1-800-PET-MEDS, America's largest pet pharmacy. Call now or order online.
Go to petmeds.com/doctor, DOCTOR, to get 10% off any order and free shipping on orders of $39 or more at petmeds.com.
This year, Americans are expected to spend a jaw-dropping $36 billion on their pets. From lighted leashes to high-end spa products, the discriminating pet owner can find just about anything to pamper his or her pet. Hi, this is Michelle Fern. Join me every week for Best Bets for Pets, where we'll talk about the latest pet products and talk to the companies that make them. Best Bets for Pets, every week, only on PetLifeRadio.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life
PetLifeRadio.com.
Radio.
Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
The last thing you want to do on Thanksgiving or the day after Thanksgiving is rush your cat or dog to the emergency room. A few simple precautions will help make sure that your holiday feast remains festive. Now, it's only natural that we want to share our delicious dinner with our pets. After all, we do consider them part of the family, and many pet owners feel that their dogs and cats should have their share of the holiday food as well. In fact, more than 60% of us will feed our pets from the table this Thanksgiving. But all good intentions aside, there are many holiday treats that can cause serious medical problems for our pets. Our signature dish, the Thanksgiving turkey, may seem harmless enough, but the wrong parts of the bird can cause vomiting, diarrhea, or even intestinal blockages. Now, while a small amount of lean white meat might be a nice treat for your dog or cat, avoid giving your pet any of the skin, fatty pieces, or most especially the bones. The skin and fat of the turkey can cause digestive upset, or worse, a condition known as pancreatitis. This inflammation of the pancreas is very painful for pets and is common during the holiday season. Poultry bones splinter and can really cause a lot of problems in the intestinal tract. These fragments of bone can lodge in the pet's digestive tract, causing an obstruction or possibly perforate through the tract, setting up a life-threatening emergency. Likewise, discarding the items that were used to cook the turkey should be done with care. Basting bags, skewers, the string will still smell yummy and smell of the bird and may be very tempting to that hungry pet. Be sure to dispose of these items in a pet-proof container, preferably behind a locked door. There are other items on the table that can cause problems too. Any high-fat or extremely spicy food has potential to upset your pet's normal digestive process. Foods prepared with onions or onion powder can cause destruction of your pet's red blood cells if consumed. Grapes or raisins are known to cause kidney failure, and even those delectable baked goods may be dangerous. Some of these desserts contain an artificial sweetener, xylitol, that has been implicated in liver failure and a sudden decrease in blood sugar in dogs. And under no circumstances should your pet ever consume alcohol. Remind all your Thanksgiving guests that your pet has their own food and does not need any treats from the table. Sometimes it's hard to convince your pet of that also. So what you might want to do is to go ahead and pop your pet in the other room, close the door so it doesn't try to sneak some treats under the table. talk to your family veterinarian about emergency services just in case you need it during the holidays and they may not be there. Following these guidelines will keep your whole healthy family just that way for the entire holiday season. If you want to learn more about some safeguards for your pet, learn more about pet health, you can always go to www.myvnn.com where this information came from. Thank you so much for listening. Have yourself a great holiday season. This is Dr. Bernadine Cruz speaking to you for Pet Life Radio and the Pet Doctor.
Pets can be a wonderful addition to your life. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.
The Pet Doctor is sponsored by Ellie Mae Pet Supplements. Ellie Mae is an animal healthcare company that creates products which focus on improving the overall health and quality of life for your much-loved pet. Visit us at www.battle-cancer.com for more information on dog cancer and how Ellie Mae supplements can help your dog.